The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
Computers have changed our lives, but what has working on them done to our health? You see their claims in the yellow pages, or perhaps seen their work on someone else. Plastic surgeons, so many to choose from. How do you know whom to trust? Have you lost your hair? What about your self-confidence? For many men and women, they can answer both questions with a big yes. So how much attention have we paid to the thymus gland as a solution? Do you know where to turn for preventative medicine? For many people, going online is a good start. The internet rage has made information about cancer extremely accessible. One website in particular has empowered patients and, in turn, helped them in their battle. And for allergy sufferers, an innovative pillow cover is keeping dust mites from interfering with our sleep. All these topics are next on Today's Health. This program is brought to you in part by Microair Surgical Instruments, World Web Information, Biotechnique Complex Incorporated, the Kronos Group, CancerSource.com, and AllergyDirect.com.
Technology has given us opportunities, but new devices we've made part of our daily lives have also created some additional health risks. Hello, I'm Robert Urich, and this is Today's Health. As computers become so ingrained into the way we live, work, and play, many people are experiencing injuries from the repetitive movement of simply working at the keyboard.
The carpal tunnel is an anatomic bottleneck at the base of the wrist through which all of the flexor tendons and the median nerve pass into the hand. It's a bony canal on 3 sides and a layer of gristle which forms the roof, and it's quite a tight space for the nerve. The symptoms are usually pain, numbness, and tingling in the extremity. The symptoms are very often present at night, will often waken people from sleep.
Carpal tunnel syndrome is not a new disease. However, since so many people are spending a lot of time in repetitive tasks like working at a keyboard, it is becoming a more significant health issue. The American Academy of Orthopedic Surgeons estimates that there are between 400,000 and 500,000 new cases of carpal tunnel syndrome annually.
I woke up in the middle of the night and thought somebody had cut my hands off. Excruciating pain from the wrists all the way through to the fingers. I lived like this for almost a year in elastic gloves. I couldn't button a button, I couldn't cook a meal, I couldn't even boil water, I couldn't carry a pot. And I saw Dr. Luskin. He looked at my symptoms and he said, definitely I have carpal tunnel.
In many cases, surgery is the most effective way to correct this problem.
When we do a carpal tunnel release, what we're doing is we're cutting this layer of gristle, and it allows the canal to spring open to a wider volume.
The other surgery that I had considered was, which they used many years ago, was where they opened up the whole hand. And it's a very rough surgery.
Many doctors are now looking for less invasive surgical options like the Microair Carpal Tunnel Release System. This endoscopic procedure only requires a tiny incision in the wrist to incise the ligament and relieve the pressure.
The Microair procedure is truly an anatomically logical procedure. It makes use of natural tissue planes to enter into the carpal canal instead of cutting through skin and other tissues, which saves the patient a lot of postoperative pain.
I was bandaged for 3 days, took off the bandages myself, and a week later the stitches came out. And to me, you were able to use your hands immediately. I'm 6 weeks post-op with this hand and 4 weeks post-op with this hand, and I cannot tell you how wonderful it is to have hands again. It's like living all over again. I can do everything.
As technology continues to propel us through the information age, work-related injuries due to repetitive motion could become an increasingly significant cost. Hopefully, innovative, less invasive surgical procedures can minimize those costs and help people recover faster and more completely.
With managed care as big as it is, an individual's health needs are often overlooked. That's why many people are entering the online world of age management programs. After logging on, you'll quickly see it's anything but impersonal. This topic next.
Preventive medicine helps us maintain our health, and fortunately, there are many new ways to help us prevent disease and live better.
Americans today are living longer, which is good news to the nearly 76 million baby boomers who are presently middle-aged. Many of them have taken an active role in maintaining their health and have made a commitment to their personal well-being.
Baby boomers today face several issues, one of which is to obtain good health care and maintain their health as they age.
As I've gotten older, I realized that I can't do things I was doing when I was 20 and 30 and 40. So now I'm more concerned about my health and the way I view it.
In the last 20 years, health-related innovations have emerged and thrived in this health-conscious environment. In order to maintain optimal health while they age, many consumers have adopted an innovative approach called clinical age management.
Clinical age management is the practice of assessing all the individual items that change as we age and addressing those individually in a preventative fashion. That is, we don't wait for something to go wrong, we address it a priori and treat it effectively.
This science-based, preventive, integrated approach to healthy living and aging, developed by the Kronos Group, identifies risk factors for age-related diseases, including osteoporosis, cardiovascular disease, cancer, impaired cognitive function, and conditions like hormonal imbalance, which can produce symptoms of fatigue, mood swings, and a disinterest in sex.
We cannot stop the aging process today, but what we can do is we can evaluate risk factors that an individual has. The value of being able to identify individuals' risk factors are very important, specifically to that individual. Each individual will have different risk factors. At Kronos, we look at 150 different biomarkers that look at risk. And after we have a risk assessment, we can take steps to help lower that risk.
We take the results from these 150 or so assays. The physicians interpret those results and can then prescribe a treatment plan and supplementation based on those specific results. We present the results of each individual assay on the laboratory report in both a numeric and a color graphical form. This allows the patient to very easily see if they are in the green or good range or the red or less than optimal range.
When it comes to our health, prevention can help us avoid those major diseases that can compromise our quality of life or even become deadly. It's important to know what we can do to help prevent serious diseases, and even more critical, to take action.
Medical science has developed amazing treatment options for age-related diseases. But now there are risk-reducing options where physicians can focus on providing more personal care and attention. But the challenge for today's patient is finding the time to gain more control over their own health. Years ago, physician house calls were a natural part of how healthcare was delivered. Doctors spent more than today's average of 8 minutes with each patient. The Kronos Group created KronosCare.com to overcome that challenge.
The Kronos website is known as KronosCare.com, and it's not just another website. It is actually a healthcare delivery system. It's the 21st century house call. In the old days, a doctor was able to go to a patient's house and spend as much time as he needed. Today, a doctor unfortunately can spend 6 to 10 minutes with the patients. That's very frustrating for patients. We know that at Kronos. And by having KronosCare.com, a physician can spend as much as an hour's time answering questions. And then that physician is able to answer questions through email that a patient might specifically have. This makes it very comfortable and convenient for patients to get information.
Consumers wanting to take advantage of this site can fill out an online intake form, choose a physician, and schedule an in-home physical exam. About a week after the in-home exam, the patient is notified that their lab results are ready, and a secure online audiovisual consultation with the physician is arranged to review the lab results and develop a strategy of exercise, nutrition, supplements, hormone replacement therapy, and, if necessary, medications to help reduce the risk of age-related diseases. Then, throughout the entire program, patients are able to log on to their personal health page, where the latest scientific research on clinical age management and other requested topics of interest are available, and questions can be answered.
A lot of our patients are very proactive and they want to know the information, up-to-date, cutting edge. By being part of our online program, they're able to see the most up-to-date research just by clicking on their computer.
The real beauty of our database of information about patients is that we will be able to more accurately assess both the risk factors and the protection factors of all these various assays for a patient and each of their biological systems in a fashion that has never been done before.
I'm much more confident about my health. I'm much more at ease, the way I'm going, where I'm going, and the way I'm aging.
As healthcare policy experts and politicians argue over how to create an ideal healthcare system, baby boomers are creating solutions to improve their health and reduce the risk of disease. It appears that Kronos has developed such a solution by integrating science, technology, and preventive healthcare.
You're thinking about plastic surgery, but many surgeons who claim to be professional are not even certified. So where can you find a reputable doctor who is? Trying to prevent hair loss is often based on trial and error. As new studies are conducted, alternative treatments result. We'll show you one that may raise a few eyebrows next.
Many people are considering cosmetic surgery, and the benefits can go far beyond simply looking better. Taking a few years off your appearance can have positive psychological effects, like boosting self-confidence and raising self-esteem.
Are you completely satisfied with the way you look? Many of us have features we'd like to enhance or improve, and today's plastic surgery procedures offer us many options. The key to a safe and successful procedure is often finding the right plastic surgeon. Simply looking up a plastic surgeon in the yellow pages or a preferred provider handbook does not always give you the critical information you need. One very important qualification for the doctor you choose may be whether or not that professional is certified as a plastic surgeon by the American Board of Plastic Surgery.
Board certification is a process. You need to meet certain requirements before you're able to be eligible for board certification or even attain that. So there's a number of years of training that you've got to complete. Then you've got to complete a written examination and finally an oral examination.
I thought that anybody listed in the yellow pages under plastic surgeon was qualified to do my procedure. But it was after talking to my family physician that she told me the importance of finding a board-certified plastic surgeon.
Many consumers who want to find plastic surgeons with a board certification are turning to the internet. Websites like plasticsurgerydoctors.com, sponsored by World Web Information, are totally dedicated to only board-certified plastic surgeons and provide information about surgery and the alternatives available. This site lists plastic surgeons by location and specialty.
There are really two important features that are valuable to the consumer. One is information about plastic surgery, about board certification in plastic surgery, about plastic surgery procedures. The other is a venue through which the consumer can find plastic surgeons that are board certified plastic surgeons and know that that's what they're getting.
Any surgery involves a risk of complications. That's why it is so important that a qualified plastic surgeon perform the procedure. Knowing that the doctor has served a residency and has been tested can help give you a good indication that he or she has the experience necessary to do the operation properly.
So I began my investigation through the internet, and it was there that I find a board-certified plastic surgeon specialized in the procedure that I wanted. The operation was successful, and I am very pleased with the results.
It doesn't matter if you're looking for a facelift, a tummy tuck, breast enhancement, or liposuction, cosmetic surgery is serious. Unfortunately, the internet is a powerful reference source to help find the right plastic surgeon who can help ensure that the procedure is both safe and successful.
The keys to healthy living are not a mystery. Proper diet and exercise can help us feel better, avoid disease, and live longer. Unfortunately, with our busy lifestyles, the two things that get shortchanged are often our diet and exercise. Maybe it's time we rethink our priorities. Now let's take a look at this health topic.
Baldness can occur for many reasons, including metabolic disease, genetic traits, environmental factors, allergic reactions, aging, anti-cancer treatments, and skin disorders.
Hair does leave the head. It's shed, about 80 hairs a day. But when you have baldness, then the hair loss can be as much as 500 hairs a day. Baldness is known generally as alopecia. With alopecia, there is hair just falls out of the head. For women, it's a gradual thinning of the hair. For men, it fits a specific pattern, male pattern baldness.
Fortunately, researchers in trying to stop hair loss in chemotherapy patients may have found the key to stopping baldness in many other ordinary men and women. The studies originated in Germany, where physicians performed controlled tests on cancer patients. Some subjects used a shampoo and scalp lotion called Thymuskin, which contains an extract from the thymus gland. Others followed the same procedure, but with a placebo. The results showed that the patients using Thymuskin suffered minimum hair loss.
And those patients receiving Thymuskin, those patients grew hair in an exceedingly large quantity within a period of 3 months.
I was losing 350 to 400 hair a day. Up to 100 is normal. A friend of mine, she had lost a tremendous amount of hair too, so we were both in the same boat. And one day she calls me with this Thymuskin, very excited, telling me, hey, you have to try it. So I had nothing to lose. And 3 weeks later, I was stunned, in heaven. My hair had stopped falling out from 400 a day to 5 hair a day.
Evidence points to the fact that baldness is connected to an autoimmune disease. By using a formula to stimulate the thymus gland, you may be able to stop balding, regrow lost hair, and even boost your overall immune system. It's amazing how a breakthrough in one area can help bring about breakthroughs in other areas. Developing a formula that can help cancer patients retain and regrow their hair may be the key for solving the hair loss problem that confronts millions of healthy men and women.
Advanced technology is giving all of us greater access to more health information than ever before. If you want to explore an issue, the best place to start is our website. So come visit us at vstar.com. Someone very wise once said that it's not how long you live that counts. It's how well you live during the years you have. If we can take charge of our health and maintain it, we may be able to live better and longer. There are many good ideas to help us stay healthier. Here's one now.
The reason why I went to see a doctor is because I couldn't breathe in the mornings, and I woke up sneezing with runny nose every day, and I just knew something was wrong.
The allergy patient doesn't realize it, but he is actually sleeping with the enemy. Little does he know that the mattress, the box spring, and the pillow are infested with the house dust mite.
Most people don't realize it, but their pillows and mattresses are like the promised land to dust mites. Dust mites are microscopic insects that are everywhere all year long. Their waste carries allergens that affect nearly all allergy sufferers.
The doctor told me that the first thing I had to do was change all the bedding.
The dust mite is a small, in fact microscopic, 8-legged creature that lives in everyone's home. It feeds off the human skin and dander, and its particles then become airborne. The patient then inhales these particles, and many people develop an allergic response.
Who did you sleep with last night? If you think you slept alone, you are very wrong. Millions of dust mites live and breed in your bed sheets, pillow, mattress, and box spring.
To avoid and prevent dust mite allergies, it would be ideal to have hard surface flooring throughout the house, no carpet anywhere. One would then want to encase the mattress, the box spring, and the pillow in a protective covering, and if possible, try not to bring the pet indoors.
On the internet at allergydirect.com, you can find out about an innovative material called EPTFE that is now being used for mattress and pillow covers for allergy sufferers.
EPTFE, which is more commonly known as Teflon, is a microporous membrane which is manufactured in such a way that it has three-dimensional pores, and the structure of these pores is such that it completely blocks the passage of house dust mite allergen, but remains very breathable, so it allows the allergy sufferer to actually sleep in comfort and wake up more refreshed than they normally would.
Once I changed all of the things that the doctor told me to do in our house, I felt much better.
Unlike seasonal allergies, dust mite allergies affect people all year long. By taking steps to reduce exposure to these allergens, you can help prevent and avoid a nasty allergic reaction.
Most of us say that we treasure our health, but 90% of us don't even get the minimum daily requirements of fruits and vegetables recommended in the FDA's food pyramid. It's time we practice what we preach and take the right steps to stay healthy and live better.
When I first learned my uncle had cancer, at first I was angry, but then I needed to find out what there was to know, just what was out there. I needed the information. I needed to know what I could about the disease.
Progress is being made every day in every field of medicine, and that's especially true for cancer. There are breakthroughs at institutions all over the country, all over the world, in government laboratories, and unless you know what research is being done and what treatment options are available for your particular type of cancer, you're going to lose out.
There was a time when cancer was a dark mystery, and getting information about the disease and its treatment was difficult. Fortunately, a new era has dawned. Information about cancer is now readily available, and many doctors and nurses are referring their patients to internet websites like those sponsored by CancerSource.com, the National Cancer Institute, and the American Cancer Society. These sites can help them get the information and support they need to cope with their cancer better and become more involved in their treatment. Websites like this one, CancerSource.com, can empower patients and their families by helping them learn about their specific type of cancer, the treatments available, the medications, and the breakthroughs that may be on the horizon.
If you have knowledge about your condition, if you know what the statistics are, if you know what the options are, if you know that whether you're a candidate for one of these options, it can have a profound effect on your outlook and on your lifespan.
The members can even chat online with doctors, nurses, experts, and others affected by the same kind of cancer. It is all clearly presented and easy to understand.
I think when you're able to sit at the computer and have that information and then also have something done in layman's terms, you're able to absorb it better.
Knowing where to turn for easy-to-understand information and support can help empower patients and their families through the ordeal. Fortunately, now the internet can offer the power of knowledge to help in our battle against cancer.
You know, it's not always easy to look at things from a positive perspective. But if you can look on the bright side, your improved psychological well-being can often enhance your physical health and help you enjoy a higher quality of life. I'm Robert Urich. For more information about any topic we covered on this show, log on to our website at vstar.com and join us again next time as we get right to the heart of matters concerning your life on Today's Health.
Set Furnishings and Accessories by Levenger.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.